I just took this subject, this particular subject on healthcare management and laws, which is about statutory and regulatory compliance. Because as hospital administrators, this is one of the very, very important subjects. Uh, the responsibility of what happens on the statutory and the regulatory aspect will always be on the hospital administrator. The hospital administrator might always say that the clerk did this fraud, or the nurse missed the injection, or the pharmacy gave an expired drug. But when it comes to the question being raised, it is raised to the administrator and to the hospital. Nobody will call the pharmacist and ask why did you give a wrong drug. No patient will go to the pharmacist level. They will sue the management. They will sue the administration, because they expect the administrator and the management to set policies and practices and processes which will prevent such an incident from occurring. So there is no meaning in trying to feel that this is a responsibility of a nurse, responsibility of a doctor, responsibility of housekeeping, nothing like that. The overall responsibility will come upon the hospital administrator. That is where in one of the subjects you will be taught about training, about competency building, efficiency improvement. All these things will also be taught to you, because as an administrator you have to put in systems such that those improvements and those you know efficiency development take place. Okay, so now I will quickly take you through a few slides here. Healthcare. I wrote this preface down because some things that I felt were well captured by the author. So if you read this preface, healthcare is a complex structure and requires various legal guidelines to enable smooth functioning of the system. In this preface, the author is also trying to emphasize on the role of a healthcare or a hospital administrator. So please listen carefully. As newer developments occur in healthcare, newer ethical and legal challenges will come up, and they need to be addressed from time to time. Hence, there is a great necessity of laws that guide healthcare practice. Hospital administrators need to focus on understanding not only healthcare laws but also certain ethical issues to make sure they work in the best interest of both the patients and the providers. So you see, hospital administrators become the connecting link between the management and the patient, or the doctor and the patient. And no administrator can get away with any excuse in this case. No administrator can get away. The administrator has to ensure that the healthcare regulations, healthcare compliance, the laws, everything is taken care of. Just give me a second. It is also important for hospital managers to be aware of and understand the laws relating to healthcare system. There are several laws that safeguard employees and entitle them for benefits. The knowledge of these laws will help a manager deliver the necessary duties towards their employees. Further, hospitals, as a part of their operations, give rise to a lot of environmental pollution, including biomedical waste, noise, and radiation. And there are several laws governing such laws that are applicable to hospitals. The spirit and code of conduct for smooth functioning of healthcare system, however, what encompasses statutory and regulatory compliance today has undergone a sea change due to the emergence of an extremely competitive business environment. So, can anybody tell me how the emergence of an extremely competitive business environment has resulted in statutory and regulatory compliance? I'm waiting for answers. How does emergence of an extremely competitive business environment make us to follow statutory and regulatory compliance?
Sir,
Yes, I'm listening. I'm listening. Please tell me. Hello. Hello.
sir,
Yeah,
since
tell
it
me.
I- since it is a life of the patient, we have to focus on first on the patient side, and then we have to focus on business side, sir. That's why rules and regulations came, sir.
Okay. What else? How has the emergence of an competitive business environment made us to mandatory comply with statutory and regulatory laws? Okay. So I'll tell you why it has happened.
Sir,
Anybody answering?
to balance the situation in the environment, sir, in the hospital environment, so not to make any disturbances. So all this must be controlled by an administrator. So some rules and regulations will be there, sir. Uh, like that, emergency may can control by taking these subjects like that. What
So,
I am telling that.
Monica, I got your point. I understand what you're trying to say. But
Okay.
what I'm asking is not about internal regulation, internal compliance. I'm talking about, okay, what you're saying is ensure safety. Even the other candidate who just now spoke, to ensure internal safety to staff, to patients, also to prevent any incident in the hospital. There should be processes or systems to comply with, so that there is safety, there is standardization in the hospital or in the patients and
No.
the attendants. But
Yes.
the question that is being answered by the author here is,
Yes.
when we say extremely competitive business environment, extremely competitive business is nothing but a lot of hospitals, less patients. So everybody wants to pull the patient to themselves. They want the patients to come to them. They don't want the patient to go to somebody else. Okay. So what they
Okay.
will do, they will try to manipulate these services. They will try to, put some doctors' names as they are available with us, but the doctors are not actually there. They will try to, to save money. They will try to dump waste in non disposable areas. just to save money, not to give it to outside. In order to save cost, they will have lesser staff to work for them for more hours. So just to be competitive, to save cost, to earn more money, to show more business, they will do things which are not in the interest of the staff or the patient or the doctor. They will just try to see how they can save money or how they can earn more money. So when you say regulatory compliance, when there is a payment of gratuity, payment of bonus, payment of minimum wages to employees, so these HR laws will prevent any hospital or any organization to pay less than minimum wage to an employee. Like that, by competitive business, people will resort to more economical and unfair ways to earn money or to save money. So these regulations and these laws which we are referring to here, the statutory and regulatory compliance will protect the employees. It will prevent them from being cheated or being exploited by the management or by the administration. That is why with the emergence of the hospital, competitive hospital business environment, the emphasis on statutory and regulatory compliance has also gone up. Okay. Now there are healthcare laws and regulations, there are acts applicable to hospitals, there are challenges in healthcare laws. So these are all, in healthcare laws, there are professional codes of conduct and regulatory bodies. There are legal issues in patient care management. Medical negligence is what happens. Acts applicable to hospital, legal requirements for establishment of a hospital, laws governing management of human resources, laws governing environmental protection, challenges in healthcare laws, public health laws, unethical illegal activities, emerging issues. All these things are covered in this chapter to make the administrator more knowledgeable of their role in administering a hospital, keeping in mind the regulatory and the statutory laws. So after studying this unit, you should be able to know the evolution of healthcare laws. Introduction, there is something about code of conduct, there's Hippocratic Oath, there's Indian Medical Council regulations, Geneva Convention, Indian Nursing Council, National Nursing and Midwifery Council, Pharmacy Council of India. All these councils and various associations are governing the functioning of these staff in the hospitals. Okay. So healthcare laws can be said as a branch of law that deals with the various aspects of healthcare delivery system. It encompasses various subcategories like forensic law, public health law, medical practice law, etc. Encompasses various subcategories means healthcare delivery system law or healthcare law will include forensic law, will include public health law, will include medical practice law. Healthcare law deals with all areas of healthcare, starting from formulation of policies for public health to how a medical professional or a patient should behave and conduct themselves. It also includes the rules and regulations dealing with any of the above said aspects that are laid down by each individual state, country, or an international body. So when it comes to healthcare laws, let me tell you that Indian healthcare system is not totally confined only to the Indian laws and regulations. Many hospitals are slowly adopting non-Indian laws and regulations like JCI. Does anybody know what does JCI stand for? Anybody knows what JCI stands for? JCI. JCI stands for Joint Commission International. This is a body from Joint Commission for Accreditation of Healthcare Organizations. It's a USA standard levied in hospitals of United States of America. So hospitals in India are already adopting JCI. They are trying to see that their laws and their regulations or their compliance is better than that of the local governing systems. So, importance of healthcare laws. Healthcare in ancient times was mostly provider centric and was acting as per the individual practitioners understanding the principles. So, just listen to this carefully. In ancient times, healthcare was totally doctor driven. If the doctor does not want to see a patient, the patient will not be allowed to see the doctor, or the doctor will just refuse and go away. Okay, individual practitioners understanding and principles. That was the rule of law. Nobody would question. Hippocrates talked about professional ethics, which acted as a guide for professional conduct. Healthcare laws majorly serve the purpose of being a guide to various stakeholders. Do you know who is Hippocrates? Can anybody tell me? Hello? Can somebody tell me who is Hippocrates? Okay. He's a Greek philosopher. Okay. He's a Greek philosopher. And before Christ, he was born. He is referred to as the father of medicine. And he has set some ethical standards that the physicians should follow. Refer to page number 6. Can you open page number 6? Can you open page number 6?
Yes, sir.
Can you read the modern version of Hippocrates' Oath, Basic Principles?
Modern version of Hippocrates' Oath Basic Principles. I swear to use my best ability and judgment to fulfill my duty. I respect the knowledge that has been shared with me by my predecessors
Predecessors. Yeah,
and will gladly share my knowledge with my successors.
good. Yes.
I will always act in the best interest of my patient. I will call for help from my fellow professionals whenever needed without hesitation. I respect my teachers and my fellow professionals and will be glad to serve them. I will strive for prevention of disease. I will respect the privacy of my patients and will never disclose their details for any other purpose.
Yeah. So Hippocrates has set this as an oath, and even today, most of the colleges, medical colleges all over the world, will make the doctors after passing out read this oath, and they would want them to abide by this. Okay. So if you look at it, before Christ, well before Christ, Hippocrates thought, sorry, Hippocrates thought the need for a professional ethical standards to be followed in the medicine field, and he came up with this. This is not the exact oath what Hippocrates had written that time. This is a modern version. Of course, if you go onto the Google and type, you will get the Hippocratic oath, which was written by him and his disciples. So if you see in this Hippocratic oath, very clearly the doctor is supposed to be acting in the interest of the patient, ensure confidentiality, ensure teamwork by taking help of fellow professionals, ensure respect and service to teachers and fellow professionals, and of course ensure to fight and and provide disease prevention rather than always focusing on disease cure only. Now, for today, we will end this class here because I don't have. Uh, one second. One minute, please hold. So, okay, sorry, we can go forward. So, the scope of healthcare laws is very wide. It includes implementation of health programs. If you go to page number 4, you will find the scope of healthcare laws and evolution of healthcare laws. It talks about what does the healthcare law include. It includes implementation of health programs, collection of healthcare data, financing of various healthcare development. Scope of health laws cover all the sectors of healthcare, including hospital, pharmaceutical companies, clinical research organizations, genetic engineering studies, medical device developers, non-government organizations, health insurance providers, payers, and individual medical practitioners. So healthcare law, it's not a hospital law, it's a healthcare law. Healthcare law will apply to society, will apply to private and public organizations which are providing healthcare or medical care. It will apply to the financing of healthcare development in the state or in the private sector. It will also apply to medical device, genetic engineering, clinical research. All these things will be governed by the healthcare laws of the country or the state. So if you look at evolution of healthcare laws in 1946, the Boer Committee was the first one to make recommendations. Post Indian independence, the national health policy was framed in 1983 after the alma mater declaration of World Health Assembly Health for All by 2000. Of course, health for all has not happened yet in India. Many people don't get health services, medical services even today. Well, most of the healthcare laws that we see today have also evolved from colonial laws and made additions from various case laws, international declarations, and health conventions. With growth in private healthcare organizations, various laws governing the standards and rules to regulate the way of healthcare delivery became mandatory. Again, emergence of competitive business environment. Read the line, with growth in private healthcare organizations, various laws governing the standards and rules to regulate the way of healthcare delivery became mandatory. Okay, so it is the growth of the healthcare sector, private or public, has made the governing of healthcare rules mandatory and the healthcare system mandatory. What is the professional code of conduct? Oxford Dictionary defines code of conduct as a statement setting out guidelines regarding the ethical principles and standards of behavior expected of a professional person or company. Same thing in code of conduct for a given organization or a profession is a generally agreed set of rules that govern the behavior, practice and standards of that particular organization or profession. Like the Hippocratic Oath will govern the practice of medical profession. Same way, the code of conduct is decided or is put in place by either hospitals or by private either by hospitals or by government setups or government regulatory bodies to ensure the proper code of conduct is followed in the system. Importance of code of conduct: it quantifies the standards that has to be followed. It acts as a guide for organizations to set rules. It acts as a benchmark to measure one's performance and standard of work. It acts as a guide for decision making and eliminates ethical dilemmas. So I'll just quickly give you an example of what means by quantify the standards that has to be followed. Now, ethical code of conduct. I should not make my patient wait for hours together. It is important that when the patient has come for any service, we should try and fulfill their requirement. Of course, the focus on emergency is always much higher, but then importantly, we should ensure that in general, the patient is given priority and within a agreed time, a standard or a fixed time, the patient is given treatment. So it quantifies the standards that has to be followed. It acts as a guide for organizations to set rules. Now, when we say code of conduct, when we say that patient has a right to second opinion, patient has a right to know about their own medical condition, when we talk about all that, we also talk about how the patient has a responsibility to disclose all their information to the doctor, how patient has the responsibility to seek clarification, explanation from the doctor. How patient has a responsibility or attendants have a responsibility to paying the hospital dues upon the continuing treatment. So when we have a code of conduct which is governed by the country or by the local state, then the organization can set rules to follow. The code of conduct framework also acts as a benchmark to measure one's performance and standard of work. So if one's performance or standard of work is good as per the set standard, set rules of the organization, then we can compare how the organization is performing, how different people, different professions in the organization are performing. It acts as a guide for decision making and eliminates day-to-day ethical dilemmas. So it definitely acts as a guide for decision making. Code of conduct. Let us say if somebody has misbehaved with a female employee in the organization, or a female employee has misbehaved with a male employee in the organization, then the code of conduct is very clear about suspension, about questioning, inquiring, suspending, if need be, terminating services. So the code of conduct will vary from the circumstances or the concerned environment. It could be different for nurses, it could be different from doctors, it could be different for administrative. But when it comes to certain codes which are very clear, like prevention of sexual harassment, POSH, that code of conduct laid down by the government of India is very, very clear. So it will act as a guide for decision making and elimination of day-to-day dilemmas. If I am in a dilemma that whether I should terminate a particular staff for misbehavior, that is clearly narrated in the code of conduct book that this kind of behavior should be punished in this manner. So professional code of conduct in healthcare, the National Association for Healthcare Quality says a code of ethics clarifies roles and responsibilities within a profession and provides guidance to the professional for addressing common ethical questions. Healthcare Professional Code of Conduct, as laid down by WHO, talks about 5 basic principles that any healthcare worker should follow: integrity, accountability, respect for the dignity, worth, equality, diversity, privacy of all persons, professional commitment. This code of conduct has its basis in the 4 basic principles of medical ethics, namely beneficence, non-maleficence, autonomy, and justice. Beneficence means to do good. Non-maleficence means to do no harm. Okay, the professional commitment code of conduct evolves from 4 basic principles of medical ethics. One is do good, other is do no harm. Autonomy means the right of persons seeking healthcare to make decisions. The patient should be allowed to decide. Have the right to be informed properly. Justice simply means treating with fairness. These are the 4 things from which the professional code of conduct has evolved. Good medical practice principle acts as a guide to all medical professionals practicing medicine to act in the best interest of the patient. It derives its rules from the basis of Hippocrates' oath. Okay. Some of the guidelines are: every medical professional has to apply their knowledge, skills, and experience for the knowledge skills for the betterment of the health of patients and humanity. The relationship of doctor and patient should be built on trust. Physicians should maintain cordial relationship with their fellow professionals and work collaboratively whenever necessary. Physicians should assess the risk for patient and act accordingly. Hippocratic oath. So I don't have anything more at the moment. Regretfully, it's not a complete closure of the chapter. We'll take it up tomorrow, both this chapter